Hi, good afternoon, everyone. I'm News 4's Kay Ingram, and joining me here is Dr. Edith Bracho-Sanchez. So today what we're doing is our live Q&A based on the coronavirus, right? We have posed, the option for you all to submit your questions, and as promised, we are getting those answered today. So Dr. Edith, I know that your background is in pediatrics.
That's right.
And we have been getting hundreds of questions from you all just about, what people should be aware of as far as family, relatives, and kids. So those are some of the questions we'll be talking about today. And I want to remind you all, as you're watching and where you're watching, feel free to comment as well. We'll keep track of those. So first off, Dr. Edith, for those who have a small baby, one of the questions we got was that, are they at greater risk than older kids?
Right, and the true answer here is that we don't know. We have very, very limited data on kids right now. As far as we know, the data coming out of China, kids actually seem to be totally spared from this epidemic. Either they are not getting the virus, or if they're getting it, they're getting very, very mild symptoms. So I think that should reassure parents at home that their kids are not going to be as affected based on all the data of thousands of people that we have right now, knowing, of course, that this is a new virus. Now, when it comes to younger kids versus older kids, I understand the concern. Little babies tend to be more at risk. Little babies tend to do worse when they get viruses. But I just want to remind you, as much as we are learning about this new virus, it is still a virus. Parents at home have a lot of experience with the cough, the runny noses, and they know when to look for medical attention. So I think let's remember, as scary as this is and as new as it is and as scared as we all are, let's just remember this is a virus like many other viruses. And let's just remember those things that would make us look for medical attention in another circumstance.
And so what are some of those things people should be looking out for? I know you mentioned runny nose, right?
Of course. So what I say to my patients all the time is it's okay to have a cold and stay home. You don't need to come see me for every cold and every virus that you get. So if you're having congestion, if you have a cough, even if you have a fever, you don't need to run in to see me. Now, if you have a fever and a baby that is less than 2 months old, you gotta come in. That's a medical emergency. If you have a fever that has lasted longer than 3 days, you gotta come in because I gotta start looking for other things. Could this be an ear infection? Could this be a pneumonia? So after 3 days, you gotta come in. If the fever's high and it's not coming down, you also gotta come in. If your child's getting dehydrated, or if your child's having difficulty breathing, which is different from congestion, right? Like I have a lot of moms who tell me all the time, well, my child can't breathe, and I just say, wait a minute. Are they congested or are they truly struggling to breathe? And so the two are different, and I would say those are the general guidance.
Paying attention to those signs and those differences.
Exactly.
Interesting. So another question we got is for those who are planning international travel. Those are one of the themes, and maybe for those of you who are planning in the coming days or weeks, what are some of the things that we might need to consider or reconsider at this point?
Right. So I'll tell you the official recommendation, and then I'll tell you what I've been telling my friends and family. So
we need both of those, right?
So the official recommendation is look at the CDC travel website, right? So those are the travel advisories. It's stratified by risk, by country, and then they take into account the number of cases that every country has. Now, what I've been telling my friends and family is, and what I've been practicing myself, is this. You need to take into account what your particular job is and what your risk level is. I have a job. I'm a physician here in New York City. I cannot afford to get quarantined abroad for 14 days or up to a month, depending on, how things play out, which we've seen, this prolonged quarantines. So even if I'm not concerned about getting the coronavirus in a particular country because the travel advisory is telling me that the level's low right now, I personally will not travel because I just can't afford to lose that work. I need to be here for my patients. I need to be here to respond to this. And so I just can't take that risk, and it's a rapidly changing situation. Now, if you are traveling somewhere and you have a little bit of flexibility, and if you got quarantined because the situation's changing rapidly and it's not a big deal, then take that trip. If the country that you're going is not on the CDC do not go to list, right?
Right. That's so interesting. We were actually just talking about this in the back with some of the interns about, she has a trip coming up, going to Spain, whether or not, she can even make that happen. And it's interesting that you say that about determining what works for you. You know,
Right.
can you risk it with work or not?
Right.
Because you might get quarantined.
Right. Or childcare, or a
Yeah.
number of, people have a number of
Childcare, yeah.
responsibilities.
Yeah, thank you. Thank you for that. So keep that in mind as you're booking those trips, guys. All right, so someone asks, I have been sick for a few days with a bad cold, flu symptoms. Should I get tested for COVID-19, coronavirus?
Right, and so we've been getting a lot of these questions in our practices at the moment. And so I'd just like to take a step back and explain a little bit about the testing, right? So
Please do.
we saw initially the testing was very limited, and it was just for those people who had been to China, had been to Iran, had been to South Korea, Italy, and were coming back. Now it's expanded, right? And we're loosening some of that criteria. The CDC is loosening some of that criteria appropriately, so
Right.
that clinicians on the ground, doctors on the ground, have the ability to say, I am concerned about my patients. I want to test for coronavirus, for COVID-19. Now, the issue right now, or the trouble that we're running into, is that not everyone has the ability to test for that. Not every facility across the country has the ability to test for that. And so the CDC is responding and the FDA is responding by sending lots of kits around the country. So
Yeah.
we're seeing that response increase, but we don't all have the ability to test our patients. So now, to directly answer your viewer's question, what we're asking is that you call our practices first. So I would recommend that person calls her physician and says, I'm worried about this. Should I be tested? Do you have the ability to test me if I come into your office? And is there something that you'd like me to do when I get there, right? Maybe someone will meet her, for example, in the parking lot and give her a mask or something like that, so that she doesn't expose other people. So it varies by clinic, and you just need to know what your doctor's office's protocols are.
So you said something interesting about, going to a parking lot, right? Maybe you need to get a
Right.
mask. So for people who are wondering, like maybe they, like this person, right? I have some symptoms. Do you advise, because there's this whole thing about getting a mask, whether or not you need one, we understand you shouldn't, right? Unless you're a healthcare provider or a healthcare worker or someone who already is sick. So for someone who may have just the common cold or those symptoms, should they be looking into getting a mask?
If you have
Would you recommend?
if you have symptoms, yes.
Any symptoms? Cold
Any symptoms.
Okay.
But if you have, until we figure out exactly, what is what, I would say blanket statement, yes.
Okay.
But if you have symptoms, you also shouldn't be going around places, right? Like
Out
we've been asking people, and we're really bad in this country about this. So many people come to work sick. So
Or
if
that one
you
guy
are,
who just went to that party the other day.
oh my gosh, it's just not the considerate right thing to do for others, right? So let's really be kind to each other and try to keep each other from getting this from ourselves, right? Like if we're the ones that have symptoms. So I would say yes, masks for people who are symptomatic, no masks for people who are healthy. Please save them for the healthcare personnel.
Nice, nice. So just a quick reminder, if you are just now joining us, we are here answering your questions about the coronavirus. We have a live Q&A happening with Dr. Edith Bracho-Sanchez, who is doing such a great job at filling us in, keeping us up to date, letting us know about especially family care, right, and child care as well. And I want to get back to that, if you don't mind. Just, again, for those who maybe are just joining us, what are some quick tips for young families or people with small children?
Right, so anyone with a young child out there knows that kids carry so many germs. They're little incubators. So
You like touching things too?
they love to touch absolutely everything. And it's hard to keep them from touching everything. And neither should we try to keep them from touching everything. This is how they explore their world. So I would say this is the time to practice that hygiene and to teach them that hygiene. So when they come in the house, try to get them to wash their hands right away. And it has to be 20 seconds. Happy birthday sang twice. You can turn it into a competition. You can get, parents get so creative because they have to. They have no choice, right? So this is the time to try to really, really emphasize that hygiene with your kids, and then teaching them not to touch their face as much as you can.
Huge.
And then, maybe the large gatherings of kids until we have a little bit more information is not the best thing to do right now.
Right. So you talked about touching of the face, right? That's been one of the biggest warnings I feel like I've been seeing is, try not to touch your face, just try your best, but finding that it's really hard.
It's so hard.
Like, just throughout a day or sitting at your desk and you don't even realize it. I mean, any tips for that about how you can stop touching your face?
Yeah, so I'll tell you what I do. So I've been trying, and I work in a hospital, so I have to be especially mindful about not touching my face. But in addition to not touching my face, which is a conscious effort that you have to do, I try to clean around me. Right? Like I get to work and I clean my keyboard and I clean my cell phone and I wash my hands. So that if I do touch my face, I know that the environment around me was clean as best I can.
Nice. All right, so thank you for that. That was my own personal question I just threw in there. All right, so we've been getting multiple and specific questions about kids with asthma. Any tips for families with kids with asthma?
Yes, so important. I think any family with a child that has asthma at home knows that for many kids, viruses can trigger bad asthma exacerbations. So I think this is again the time to talk to your physician and make sure that if your child is at high risk, you have asked the questions, should my child be on a daily medication, for example? Some of my patients who are very high risk, who have very bad asthma, we have to put them on daily medications to sort of reduce the risk. So if your child is one of those kids, you need to know and you need to have that medication. If your child is not one of those high-risk patients, but take, for example, albuterol, which is the medication that we give when you're just having some symptoms, you gotta make sure you have it at home and that you know how to give it. So really, bottom line is be ready. If you know the viruses are a trigger, my recommendation right now is be ready.
All right, so you all heard that, right? For those of you with kids who, may or may not have asthma, but it's specifically if you do, just be ready, right? Having that albuterol, which I'm very familiar with. I have relatives with asthma, so I know what that's like, keeping at the ready. So, we want to know, are people overreacting to this virus? As we're live right now, we're under the understanding that we're at 22 confirmed cases. And, the governor has expressed that people are 80% chance of fully self-recovering, but there's still that worry, right? There's conversations. It feels like every few minutes there's maybe a new case. Are we overreacting? Are people overreacting?
So I would say yes and no. Yes, in the sense that for the vast majority of us who will go on to get this virus, because I do think many of us will get this virus. I think that is, we don't know for sure, we can't say for sure, but the likelihood is that a vast majority of us will get it. So I think for most of us, it's going to be a very mild, cold type of infection, and that'll be it. So in that regard, yes, we're overreacting. But at the same time, I understand that this is a new virus, that we are learning, that this sounds new and it's scary to people. And I also understand that there are people out there who are at higher risk based on what we know, based on the data right now, which are the elderly, men who smoke. So those people with underlying medical conditions.
Heard that one, the smoking one.
Yeah, and I think that was, out of the data in China, we saw that men were much more affected. And really, when we looked and said, what are the differences here? Men smoke way more than women do in China. And so really, bottom line is, for the vast majority of us, this is going to be a minor illness if we get it, if we come into contact with it. But I understand that there are people at high risk. And so, yes and no. Let's not panic and take common sense precautions and prepare.
All right, so y'all heard that, okay? Dr. Edith, we've got the governor now. No real cause to overreact. And as well, we've been providing information on NBCNewYork.com, on our Instagram, just, reminding folks that there isn't, a reason just yet to get anxious about this. So what I'm anxious about is this warm weather coming up, and so are some of our viewers, but because of the coronavirus, is that something that people need to be worried about? That's one question we got. This warmer weather. Yeah,
so the hope, and we have no data for this yet because this virus is so new, right? Let's all remember that as of December, no human being had ever been diagnosed with this virus, so we're learning. But the hope is that with the warmer weather, we're going to see the cases start to come down based on what we know about other respiratory viruses, right? Like we know the rhinovirus, other coronavirus in the same family, remembering that this is a family of viruses, it's not just one virus. Influenza go down in the summer and late spring. So the hope is that the warmer weather is going to bring us some relief. Is it actually going to happen?
We'll have to wait and
TBD.
see. TBD. Well, thank you so much, Dr. Edith. But before we let you go, just again, thank you so much for being here. But anything that I didn't ask, maybe questions that you and your friends maybe are talking about, or that you've been getting that you think would be helpful to our viewers?
Yeah, so I think the preparation is a big, big thing that I've been, asked about. I had 3 family members call me, really, what do I need to do to prepare? And I said, get enough food. If you are quarantined for 14 days, what things would you like to have at home? And if you get a cold, what do you like to drink and eat when you have a cold? I like to drink chicken soup, and I like to drink ginger ale. It's what makes me feel good.
See,
what
I
makes
love
you?
Ice cream. I don't know if that's what I should be.
You should be purchasing ice cream. And if you have a cold, you're ready. Like, eventually you might get a cold, so it's not going to go to waste if you buy some of those items. But beyond that 14-day, like, there are people hoarding, there are people, let's be ready, but let's also not overreact and hoard.
I love that. No overreacting, okay? You all heard that. No overreacting, maybe no ice cream. Or maybe we can. Well, thank you so much again. We really appreciate having you, Dr. Edith Bracho-Sanchez, answering our questions, answering your questions, right? And of course, we'll be bringing you more information, guys, on NBCNewYork.com, our social media platforms. And if you don't have our app, now is a great time to download it, because we'll be giving you more updates as the days go on. Thanks for watching, and thanks for joining us.
Of course.
Thank you for joining us, too.